Thank you, Senator Bennett. Senator Casey.
Mr. Chairman, thanks very much. I want to thank both witnesses today and especially for your commitment to public service, both Professor Shambaugh and Dr. Haffajee. I wanted to start, Doctor, with you to commend the research work that you've done, the public policy work you've done. I wanted to ask you a question that focuses on home and community-based services for seniors and people with disabilities, which is a real failing. The lack of investment in this priority is a real failing of the federal government over a long period of time. The only way you can get those services in America today is if you're the beneficiary of a waiver, and the waiting list for those waivers is approaching 1 million people. We should invest in the expansion of home and community-based services if we're going to call ourselves the greatest country in the world and the country that claims to provide the best care to our people. But we haven't gotten there yet, and we've got a battle ahead to get there. I wanted to ask you, though, in particular about the fact that if we make this investment, it'll not only be better for seniors to get care in their home and people with disabilities to get care in their home or in the community, and there's an extraordinarily high preference for that, but it's also cost-effective. It's better for the federal government if we do this. So could you talk about the research that you could do if you were confirmed as the Assistant Secretary for Planning and Evaluation to assess savings to the Medicare program if we were to increase access to these home and community-based services?
Thank you for the question, Senator Casey. And as you note, home and community-based care services are so important, are becoming more and more, we have done a lot to shift the balance towards those, but have more work to do, and are becoming more and more important as we have an aging population, as we have more chronic conditions, as people really want to receive care and services in their homes as much as possible. I can attest to that, having had a mother who had a chronic health condition and saw her preference for that strongly. I think the principle is that we need to make sure that those services are high quality and meet the needs of our beneficiaries, and then also that the workforce is expanded and it works in safe conditions, is reimbursed. Those are some of the, I think, top priorities there. Another important issue, as you note, is these can be cost effective, both within the Medicaid program, where states are trying to expand their dollars as much as possible and put them towards the most effective services, but also potentially in the Medicare program as well. To my understanding, there hasn't been a lot of research so far on that interaction between the Medicaid and Medicare populations. If I were to be confirmed, I would be happy to have further conversations and think about the ways that ASPE could look at that issue.
Well, thank you. And I'm grateful you mentioned the workforce, because that's another part of the problem. If you're going to say you have the best care in the world and you're paying people on average $12 an hour, that's not the best care in the world. And that's why there's such a high turnover and a real workforce crisis. Professor, I wanted to ask you about labor market recovery. What's your view of the most important steps we could take to ensure that we complete our labor market recovery?
Well, Senator, I would say in some ways many of those issues would probably rest to my left. Right? I think the continuing complications coming from the pandemic continue to keep, not necessarily for, say, what we'll call prime age workers between 25 and 54, but workers that are a little bit older than that. Many of them, it seems, still haven't re-entered the labor force. Some of that does seem to be either because they're caring for people due to the pandemic or concerned about the pandemic themselves. That's one concern I would say that we've definitely seen. I would say in general, robust growth in the economy is often the best tonic for the labor market, and so continuing a strong economy is the best way to get people to work generally.
Thanks very much. Thank you, Mr. Chairman.
thank my colleague, Dr. Haffajee. I just want to build for a quick second on what Senator Casey was talking about with respect to elder care and care at home. One of the things that I look at, and I've been at this since the days when I was director of the Oregon Gray Panthers, years and years ago, is what are the principles that we ought to be looking at for the future? For example, I think healthcare prevention would obviously be one, and it's in your bailiwick. But Senator Casey has been prosecuting this case so well and so relentlessly on another area that ought to be a foundation of American healthcare, and that's more care at home. And as he noted, and I remember watching him work at Gerontology Association, was supportive of the work that Senator Casey's doing, to be able to give people more care where they want it at home at less cost. That's about as good as it gets in terms of public policy. So I really look forward to working with you as you follow up on Senator Casey's work with respect to elder care. Because if you look at two of the key crucial health pinnacles for the future, one of them is prevention and the other is taking care of people at home. And by the way, what we found in this committee is there's huge interest in America's technology sector because they too know that there's an opportunity to get more services that are compassionate and cost-effective. So we want to work with you as you follow up with Senator Casey.